I want to pose a question to you. Have you ever been a clinician and wanted to improve safety and quality in your hospital or your health service? Have you ever been in a management role and wanted to address an important safety or quality issue? Are you doing quality improvement, but it hasn't been able to be sustained? Or perhaps you haven't known how to get leadership and management of your facility or your hospital. So we think that the quality improvement toolkits can help. And now these toolkits have been developed and are being developed for a number of reasons with yourselves, clinicians and managers in the system, and we're really grateful for that. So why use the toolkits? Well, we think they can assist in improving safety and quality via a really structured approach. So we know that improvement science methodology is going to be very helpful. So it's a step-by-step guidance with specific examples of things that you might wish to address. And we know that quality improvement is the application of improvement science methodology, tools, and processes to improve safety and quality. The other opportunity will be that you can share learnings through a community of practice that we're establishing to share learnings across hospitals and LHDs, talk with peers and colleagues about your work. And also the ability to track improvement progress via the Quality Improvement Data System Platform, or QIDS. Next slide, please.
Thanks, Harvey.
Thanks very much. And I'll just introduce Jackie. And Jackie works with the medication safety team and she'll take you through the toolkit. Thanks very much.
Thank you, Harvey. First, I'd like to thank you all colleagues who helped the CEC develop these toolkits. And I'm also grateful to my team who helped progress the toolkit to the product that we'll be showing you today. So today I'll be showing you the medication reconciliation toolkit as an example. But before that, I just want to show you what all the CEC toolkits offer. So no matter you're someone who's just looking to start a project, have no prior quality improvement knowledge, or someone who is a subject matter expert or quality improvement advisor, all the CEC toolkits provide a guide to getting started. So helping you identify the problem, how to assemble a team and gain management support, into making improvements. So your diagnostic phase into brainstorming the causes of the problem, developing and testing interventions that are going to target the problem. We help you track your progress by using a family of measures and help you communicate change. So how to engage stakeholders and create awareness. And then providing education and training, which is an essential part of not just quality improvement projects, but all processes. And finally, sustain and spread your project gains. So now let me switch screen and show you what the toolkit landing page looks like. So this is what the toolkit landing page looks like. So this is the page that will be housing all the toolkits. So we've got some introduction and a drop down. So if we expand the drop down here, this is the first opportunity that you'll be able to join a community of practice specific to your toolkit. So if you click onto the link here, it will bring you to a registration page. So once you've completed the registration, it will then grant you access to QIDS, or for those who are not familiar, the Quality Improvement Data System. So this is what QIDS look like. Through the improvement project arm, I'm using Medication Reconciliation Toolkit as an example. You'll be able to see other teams who are also interested in solving the same problem that you do. And you'll be able to go through their teams also to look at what other resources they have developed. So within the platform, there are some diagnostic tools available, some measures, charts, and documents. So as I go through the Medication Reconciliation Toolkit, I'll be linking back to QIDS. Otherwise, we've also got standalone documents and resources for those who don't have access to QIDS. So now let's go to the Medication Reconciliation Toolkit. So for those who are not familiar with medication reconciliation, it is a formal process to ensure our patients receive all their intended medications and that accurate, comprehensive, and current medicines information follows these patients at all transfers of cares, including discharge. So on this page here, you will see 6 content pages guiding clinicians to start and sustain their improvement projects. And they matches with the left-hand navigation over here. And on the right-hand side, it gives you some links and resources and a contact us button. So all toolkits use the same structure with the 6 pages. So it makes it very easy for you to just navigate from one toolkit to another. So let's go into the getting started page. So for example, you're someone who just looking to start a project and don't know where to go. You can go through this page here. So for the getting started page, it helps you identify the problem that you want to solve, back up with local data, how to gain health service support, and establish your quality improvement team. So using medication reconciliation as an example, we first guide you to what is the problem you want to solve. Why is medication reconciliation important? Is there a willingness to solve the problem other than yourself? For example, let's expand this. What data do you need to support your project initiative dropdown? We can see there's some guidance on guiding you to think, have you already got some local data? For example, your incident management data or some e-health reports. Is someone already doing some baseline audit, or do you have to start collecting some data to prove there is a problem? It's always useful to have some staff and patient stories to help you prove your case. And also, I've got a gap analysis template here for you to identify where your MedRec process is and where you want them to be. And finally, and also very importantly, some literature research. We've also got, for example, improvement brief template guiding you to summarizing all the information and research that you've done into a brief, and guidance on who you can contact for help. Next, we help you to gain leadership support by explaining the role of project sponsor and what your governance structure should look like. And we've also got some guidance on who should be your improvement project team. So for example, with medication reconciliation, you'll get a project lead as for all projects, medical, nursing, and pharmacy clinical group, and more importantly, a consumer rep. We also explain some roles, what the role of the quality improvement team should be. If you're someone who are already familiar with these processes or have already gone through them, you can simply look at the right-hand navigation with all the resources available which are mentioned within the contact. For example, the improvement brief template you'll be able to find here also. So let's say you've already got an improvement team and you wonder what you should do next. You can go into the Making Improvements page. So on this page, it gives you a brief introduction to what improvement science is, with a link back to our QI Academy website for you to go deep dive and learn everything about quality improvement. So then we ask you what your project is aiming to achieve. And we've got some examples here of some aim statements. So for example, within 12 months, 85% of geriatric patients at geriatric ward A will have their admission medication reconciliation completed within 48 hours of stay. So we've got these examples here. Otherwise, you can also access via quiz, which I will show you at another example. We then guide you to reflect what your current medication practice is. So asking you to map your current practice and then giving you some tips on how to improve your practice or whether there's some gaps. Once you've identified some problems or gaps, how do you then brainstorm what the causes of these gaps are? And with some examples here, also, for example, lack of understanding of the benefits and skills to complete best possible medication history and medication reconciliation. We then ask you to make sense of the problems that you've identified through doing an affinity diagram and driver diagram. So for example, with an affinity diagram, we've got a sticky post-it note standalone document, or otherwise for those who have registered for quiz, you'll be able to click into this link, which I'll show you now. and it will bring you automatically to the page where I've got the affinity diagram here for you to look at, and also a flow chart. So next, we then introduce what change ideas and change concepts are, and guiding you to how to come up with these change ideas and how to prioritize. Finally, introducing the PDSA cycle or Plan, Do, Study, Act cycles. We've got some tips and also an example here as well. Again, linking it back to quiz. So if you're looking to track your improvement and don't know whether you've got the right type of data and amount of data, you can then go and visit the Data for Improvement tab. So here we introduce a family of measures: outcome, process, and balancing. So for those who are not familiar with what a family of measures is, you can go into the drop down, which it explains more onto what does each measures mean. So using medication reconciliation as an example again, the outcome measure I've put here is completion rate of admission reconciliation within 2 business days of admission. So it sounds quite simple, but if you really think about it, in order for your project team to help collect this data, you really need to put in some operational definition. So for example, what your numerator and denominator should be. What is the definition of admission reconciliation, and how do you know it's completed? What time frame are you looking at, and how are you going to measure and collect these information? So for example, from EMETS reports. And we've also got some tips for you to consider before collecting data. So for example, reviewing any baseline data that you already have, thinking about how you're going to collect this data, how sustainable it is, where you're going to record and share the data. Some guidance on how much data you'll need to collect. So for example, if you need to manually collect data by going through progress notes, then you probably can only do a random selection of a lower number of patients. And in contrast, if you're going to collect information that is already available through, for example, EMETS report, then you can do a longer period of search. And again, just guiding you on who can actually help you with the data collection. Then we help you make sense of the data that you present. So on the drop down here, we introduce what a run chart should look like. So this is what a chart should look like for medication reconciliation, for example. And it also links back to quiz. So if you go onto the quiz platform, it gives you a template that allows you to build the run chart very easily. Alternatively, if you don't have access to quiz, then we also got an Excel chart template here for you to use. So run chart is only one way to present data, and there's always other ways too. So in some of the steps that when it may get very complicated for someone who's just starting a project with not much QI or quality improvement knowledge, we also advise you to get in touch with your local quality advisor who can then guide you through some of these steps. So finally, we'd like you to improve the change using a flow chart that we've developed as well. So whilst you conduct your quality improvement project, there's 2 things that should go from start to finish. So one of them would be communicating change. So we've got a stakeholder engagement plan to help you plan your engagement and raise awareness. And I've also got some medication reconciliation engagement examples here. And again, resources on the right-hand side. So the same goes with providing education, which is a fundamental component in ensuring your project success. So we've got some guidance on how to plan your education sessions with some resources and a whole lot of medication reconciliation related resources for you to use and adapt locally as well. So finally, we'll go to our sustain and spread page. So how do you sustain the improvements made? We've given you some suggestions on how to integrate the improvements to everyday work practice. And how long do you need to track your sustained improvement for? And what happens if your improvement is not sustained? We've also given you some resources on how to spread the improvement. So that's all the 6 pages that we're going through today. So you'll find as you go through the pages that we've always started with some topic question for you to go through with the drop downs as relevant, providing relevant explanation and resources to help you answer the question. So if you're someone who just want to come in to look at information that you need, you'll be able to go through the questions very quickly and select the particular drop down information that is relevant for you. Otherwise, feel free to go through the whole toolkit to get a brief understanding of what quality improvement and how you can improve medication reconciliation at your facility. So that's the end of the presentation, and now we'll move on to some questions and answers. So feel free to unmute yourself or type your questions in Teams, and we'll be able to answer them.
Hi there. I was just wondering, you said you have some resources, quiz resources available if you can't connect to quiz.
Yep.
What resources are they and how do you find them? How do you get hold of them?
Yep. So we'll need to go back to the registration page where you insert some of your details, and then we'll be able to grant you access to quiz. So this is what quiz look like. So for each of the relevant toolkit, there will be a platform that contains some resources, for example, a driver diagram and other diagrams, which I showed you before, an affinity diagram, example of interventions and measures.
I've already got access to quiz. I thought,
Yep.
so maybe I misunderstood you, that you can access some quiz resources without being connected to quiz, or if you can access it without being on the network, like local network?
Yeah, so all you need to do if you already have access to quiz, we just need to give you access to this particular community of practice toolkit. So does that answer your question? So
yeah.
So
how do I get that access?
So we just need your staff link number and some details. So we would just be able to add you to the platform. So you can either contact us or you can join it through that registration website.
All right.
Which is this site. So once this site is live, you'll be able to click here, join a QI Corp and complete your registration. And then we'll be able to add you to our particular platform within quiz that you will have access.
Right. Thank you.
No problem. Any other questions?
We have a question here about when will the site be live, Jackie, please?
So there will be a number of different toolkits available. We're looking at around April time. Most of the toolkits will be live. Can you give contact details to access this site? Yes.
It's Nina here. There will be a launch and a communication strategy as well. So once all of the kits are complete, you'll be hearing about it, and we'll be definitely sending that on through this network. But if you do have any questions or wanting to find out a bit more, please feel free to contact us directly.
Hi, it's Nicola from Southern. I just wondered if you can tell us what the other toolkit's focus areas are.
Yep, so currently what we've got up already are Amber Care, Bundle, Medication Reconciliation and Sepsis. And we've got a list of others. Let me just look. So some other ones that are coming up would be VTE, Comprehensive Care, Antimicrobial Stewardship, Last Days of Life, and others. We don't have a finalized list yet, but I encourage you to contact your program-specific contact at the CEC and ask more information. Or is there a particular toolkit or area that you're looking to find?
Look, no, not particularly. I was just interested to know what the topic areas were. My roles just become quite generalised, so it will be useful to know the various toolkits so that I can spread that information to the relevant people.
Yep, thanks. As Nina explained, we'll be sending some communications with all this information. And we hope that one of the ways to develop and standardize all the toolkits is to help you then be able to navigate these toolkits easily.
Jackie, if I could just say something, so it's Harvey again from the CEC. The intent is really to have toolkits to support the major harms to our patients across the system. And that's sort of what we're developing. And obviously we're very keen to get feedback as they get rolled out as well, because we're also applying a Plan, Do, Study, Act to our toolkits over time to make sure that we can make them as most useful for all of you in the system as well.
Any other questions?
Jackie, it's Mary Fullick. For those online, I'm the Senior Improvement Lead in the Adult Patient Safety team, but work across a number of programs. And I've been working with Sarah McTaggart and Ryan Thomas on the Sepsis Toolkit. We've had some interest from a number of teams who are about to start a piece of work around sepsis improvement. And so it's early days for us, so we're going to offer some coaching with the use of the toolkit, and obviously we have to see from a resource perspective how that pans out, but that's going to give us really good feedback and an opportunity to partner with the LHDs. But what will be really important for using the toolkits is connecting with your local quality and safety clinical governance units and seeking out help, because there will be components of it that are tricky, and it's great to have that on the ground guidance. But there'll always be support at CEC, but it may not be as much as you might need. Thanks, Jackie.
It's Philippa here at Northern Sydney. I've put in a question, will there be a toolkit for blood management in the future? Thanks.
I'll answer this one if you don't like, Jackie. It's Harvey again for CEC. Look, at the moment we haven't got one planned. However, it's a really good question and we'll take it on notice and see what's available for the blood program. So thank you, Philippa.
Thank you.
Harvey, that certainly sounds like something that we would like to get involved in. It's Kate here from Governance Insurance at the CEC that oversees the Blood Watch program.
Thank you, Kate.
If there's no more questions, then we can conclude the session a little bit early.
Thanks very much, everybody. Appreciate your time.
Thanks, Jackie.